Hi, Dan here. I'm a mental health clinician working in the Head Start, Early Head Start, and Child Care program here at the Opportunity Alliance. And today I thought we could talk about how to talk to young children about COVID-19. I would recommend that the best way to start is first to identify their feelings, or first try to investigate what they might be feeling. Are they feeling sad? Are they feeling confused? Are they feeling mad? Are they feeling mixed up, or maybe a combination of all those feelings, which certainly can happen for a child, but even an adult? And just talking about, I wonder how you're feeling today, or even making guesses about, I'm wondering if you're feeling sad. I'm wondering if you're feeling confused because, usually we go to school and today we're not, and I know you're hearing about that we're probably not going to go back to school. And I know that you got really sad when you wanted to go to the playground and I told you we couldn't go in there. So that begins the conversation. That does a couple things, a few things actually. Identifying the feeling gets them on board with you being able to see them. It gives them the idea that you are looking at them, you are seeing them, you are curious about them. So that does that. The next, it kind of sets the stage for them to connect with you and you to connect with them, to talk about this really big thing like COVID-19 and the pandemic. And secondly, it normalizes what they may be feeling, either mixed up, sad, angry, confused, and that there's nothing wrong with them, that this is really a sad time. This is really a confusing time. And those would be kinds of things you would want to say to them. It's like, yeah, this is a sad time. Yeah, this is a confusing time. So that makes them feel like there's nothing wrong with them and that this is a real thing. The next thing you might be helpful to do is to ask them what they know. Young children usually know more than we think as adults because they're always observing, always watching, always taking in information. And sometimes they understand it and sometimes they don't. So just asking a simple question like, I wonder what you know about this already. Because you're doing a lot of work. You're washing your hands, you're keeping yourself safe, we're staying together as a family, and I wonder what you know about it already. And so they may tell you things like, well, I know that we can't go to school and we have to stay together, we can't go see grandma, and we can't go to the playground. And they may say things, I don't know why. Or maybe they will say like, because it's dangerous. And that would be a great way to say, you know a lot about it already. And would you like to hear more about that? And hopefully the response is, well, yes. Or they may say, I don't know anything about it. And that's a great way to start too, is to say, would you like to know more about it? Because I'd like to share that with you, because we're all going to do a lot of work together and we're going to make it through this. And again, hopefully the response is, yes, I want to know more. So I would start out with concrete and simple ways of explaining things, especially to young children. A great way, one way to do it is to maybe say, the virus is called COVID-19. There's a virus that is making a lot of people very, very sick in the world. And a virus is like germs that get on your hands, germs that can float in the air when there's a lot of people around. And we need to keep ourselves safe so that the germs don't get into our body. Either we don't breathe them in, or we don't get them on our hands and then touch our face and they get in through our mouth or nose. Anything like that that's concrete that they can actually see, touch, and understand would be helpful for a young child. And explaining it that they're doing a lot of help in the world by washing their hands, not touching their face, and staying just with their family and not being able to go to the playground even though it's hard, is really helping the world by them staying healthy and safe. And that's why we're doing this. We have to stay healthy and we have to stay safe so that the world will stay safe and people will not get sicker. So for now, this is what we're going to do, is we're going to stay together. We're going to keep washing our hands. We're going to really try really hard not to touch our face. And so these germs, the virus, won't get inside our body and make us sick. And then we won't spread that around and let other people get sick. So we're all doing a lot of work. And the last thing, I guess, is to say that is to honor the work that they're doing, I guess. That is a very important thing. And also to celebrate that they are making an effort, that they're working really hard, and that they're helping to keep themselves and the world safe by following all of these directions, all of these rules about staying together and keeping our hands clean. All of these rules are helping to keep themselves and the world safe. And important to tell them that they are among the helpers.